Well, thank you so much for staying with us. Let's get on straight with it. You can tweet at Trevor Mbija at Citizen TV Kenya. Use the hashtag Monday Report. This is where we're talking about the rising COVID-19 cases. Should the government really claw back on the relaxation of the COVID-19 protocols? Considering 21 days later, there's been a spike. Joining me now is Professor Anzala, professor in the Department of Medical Microbiology at the University of Nairobi, and Dr. Mochonda Chibanzi, the Secretary General, Kenya Medical Practitioners Dentist Union. He'll be bringing in the angle of the medics. We know now 17 of them have lost their lives. All of those infections are probably on their front line when they were dealing with patients who have COVID-19. Professor Omu, I'll start with you now. So what are we currently experiencing? Is this a second wave of infections or just a peak of infections?
Yeah, thank you, Trevor, for having me back to communicate again and just to get a sense of what is happening and where we are with this outbreak. Personally, I don't think that we are in a second wave. What I believe is that we are seeing a spike of infection. And again, I'd also like us to be able to appreciate that in order to discuss COVID now that we know more than we knew before, is that we are going to look at county by county. So Nairobi is experiencing something. We went down, we are coming up again, and I believe that could be a spike. We are seeing a similar thing in Mombasa. But in the other counties, actually, we are just experiencing what we thought we would experience. Once the restrictions are lifted, we are going to see a steady rise in the number of infections. So personally, I don't believe that we are in a second wave as yet.
What would constitute a second wave, Professor?
You see, there are two ways of looking at it. The idea would be that the measures that are put in place in terms of ensuring that we flatten the curve are there. We are consistently, testing. We are consistently looking at the number of hospital admissions. We are consistently looking at mortality. And we see all those numbers actually decline. And when maybe restrictions are lifted, you again begin to see those particular numbers rise again. There was a period of time in the country we didn't really have enough testing commodities. And to me, that was, some kind of an artifact that really we had picked and the number of infections had gone down. So to me, once the commodities are back, you can actually see that the seropositivity is way up. It's hovering about 8 or 10% on a daily basis. So we are still on a spike. We have not really picked up to be able to say that we are having a second wave. And even if we said so, we cannot talk of a second wave in the entire country. We may only talk of Mombasa and Nairobi, because these were the initial counties where there was an immense infection previously, but these were also the counties where there was infusion from abroad. The other counties are merely beginning to experience COVID infections.
Okay, let's bring in Dr. Mochonda on this before we continue with that line of discussion on COVID-19. Dr. Mochonda Chibanzi, we've known now that 17 medics have lost their lives. Most of them contracted COVID-19 in the line of duty. What more would you like to see from the government to protect the front care healthcare workers?
Thank you, Trevor. I think the first thing that needs to come out and needs to be done, and there was a laxity in this in the months of August and September when we were doing a little of testing and less of reporting of increase in COVID cases, is one provision of quality and standard personal protective equipment. This is something that we have said over and over again. The fact that we only have certain manufacturers who are producing quality, we've not seen an elaborate measure to ensure that the ones that the local manufacturers are producing local standard and quality PPEs are enlisted and made public, and those that are not are barred from circulating these PPEs, and even from, we should not even see these PPEs in circulation.
Yeah.
And secondly, of course, is the issue of compensation. This is an issue that has been moving on quite slowly. I'd say the progress on it has been very slow. We know the cabinet approved the compensation package for healthcare workers, for those who lost their lives. It was supposed to be effective 1st of July 2020, and what we are seeing now is that there are certain quarters that are pushing for it to be effective end of this month. So we're going to lose out on compensation for those who died in the month of July, especially when we had a good number of them losing their lives. And then, of course, apart from personal breakthrough, is the motivation. Right now, you're dealing with a disgruntled workforce. And the reality is that the industrial unrest you're witnessing is because healthcare workers are burnt out and are just tired of what's happening. They don't feel supported enough. And as a result of that, then is what we are seeing. And of course, the issue of training of healthcare workers, just to make sure that you have to retrain them, and that message of protection has to be passed on and on to ensure that healthcare workers keep their guard up.
So, Chibanzi, the CS for Health, Mutahi Kagwe, said that even the healthcare workers, there seems to be some sort of laxity. People are not wearing masks anymore. Is this true from where you stand?
No, because let's start appreciating the fact that healthcare workers being on the front line, you are working in an environment in the hospital where you cannot afford to not to put on your mask. That's the first thing. And then secondly, it's your life at risk here. So there's no way you can, as a healthcare worker, and I'm very sure, and I keep interacting with most of them, and I know that most are still putting up these measures as much as possible. What we are seeing is that the public has an apathy. Political leaders have decided to go on with their political activities as normal and as usual. And so what happens is that we are getting overwhelmed in the facilities. And then out of this is that, remember that with the type of presentation of COVID you're now witnessing, which is basically not the usual symptoms that we anticipate, is that healthcare workers are continuously getting exposed even by patients who either are asymptomatic or are presenting with other symptoms that are not really COVID-19 symptoms per se.
Okay, we'll come back to that issue in just a bit. But Professor Omu, can we authoritatively say that the current spike, like you call it, is directly related to the relaxation of the COVID-19 measures that was put in place in 21 days ago?
To a large extent, yes. Not relaxation from the point of view of let's say, government or the measures. But for me, I'm looking at it at three levels. There is what I will call fatigue, because we have been at this for a period of 10 months, and human beings are creatures of habit. We are used to doing things the way we have been socialized as we have grown. So when there is an introduction of a new thing in your life, and now we are talking about social distancing, wearing of masks, issues to do with hygiene in terms of washing hands, there's a level of laxity, there's a level of fatigue, there's a level of laxity. We are also seeing there's a level of denial, and there's also a level of utter refusal. So what we are seeing is a combination of all these things, and this has been a result of constant outbreak that has been there for 10 months, and from where I see it, I don't see it ending anytime soon. So the whole issue is to really go back and revisit the measures and the guidelines that have totally been put in place in every sector. That is where the problem is coming. And we have to reintroduce messaging so that the message that we are going to send out is not just a general message, social distance, wear a mask. This message must be designed in a way that it actually talks to a specific individual, to a specific sector, that really safety begins with you. Okay. So this is really, the way we are beginning to think, and this is the way we want to be able to do things, because when you see Europe, North America, China, we now know that COVID is going to be around for a while.
Okay. I want both of you to delve into this issue, but I'll start with the Dr. Chibanzi here. So, at first, the messaging was that COVID-19 veracity is higher on people who are vulnerable, either the old or people with pre-existing conditions. We're now seeing a situation where young people who have no pre-existing conditions are facing the most severe COVID-19. Were we wrong from the onset, or have we just discovered this now?
First, Trevor, is to say that COVID-19 is a novel disease. And with that, then initially in the first 3 months, and even by the time that we announced the first case in our country, we didn't know much about the disease. But of course, what has consistently come out is that those with comorbid conditions and the elderly are at a much higher risk. Even if you look at the statistics of the mortality and the case fatality for those who've been highly affected. Of course, that does not mean that the young are not vulnerable, and that is dependent on your body's response to the disease. And that is why you're seeing, perhaps now we are seeing even the younger ones getting the disease in severity. So there's also the element of your body's immune response to this virus. So we can't say that we were wrong initially, no. That was what had come out, and it still is the case. It's just that now we are witnessing a different pattern, and that's normal for a disease that is less than 1 year old across the globe, and we're just learning more and more about it every single day.
Yeah. Dr. Chibanzi, yourself, you're a COVID-19, I don't know whether to call it survivor. It's not fair to call it survivor. You beat COVID-19. But do you think you got it in the line of duty, and can you associate that directly to substandard PPEs?
I did get it in the line of duty, that's what I'd say. Yeah. And I wouldn't say it was substandard PPEs, it was the circumstances at work that I was dealing with. But yes, I mean, as healthcare workers, we're a very high-risk group. And so even our interaction at the workplace is a risk factor for us getting the disease.
Yeah. In hindsight, do you think the home-based care approach was a good idea, Dr. Chibanzi?
The home-based care was a good idea because you were trying to limit the number of people who would go into facilities and the health facilities, and they don't need these healthcare facilities. And also remember that our healthcare facilities are not really well prepared to handle so many patients. Our capacity is still very, very low. And in fact, what we've seen is that most of the counties have actually closed down some of those COVID facilities. But essentially, what is lacking in the home-based care is an elaborate, I'd say, strategy to ensure that the person who needs urgent emergency care at home has a direct link to a facility, and that and a good example would be that if I'm sick, I'm at home and I need urgent care, there's a line I can call, an ambulance will be there within the next 10 to 15 minutes at most, and I'll get the utmost care and transfer to the facility and be able to continue care. That is what is lacking up until now, and that's a system problem that has to be fixed.
Okay. Professor Omu, we were just speaking about this issue of home-based care. Was it, in hindsight, was that a good idea, knowing that human beings are creatures of habit? If they don't feel anything, they are asymptomatic, they just walk around and infect everybody else in the house?
No, Bija. The home-based care was actually totally necessary, because part of the reason why we designed home-based care was to ensure that we decongest the hospitals with the COVID patients who don't really need to be there. And the guidelines were done very well. there was a selection criteria as to who can go home and who cannot go home. Even the issues of those who have comorbidities was looked at critically. There was also training to some extent, and the training, I believe, is still going on. So home-based care must be there, and home-based care must actually continue. We know that most of our patients are asymptomatic, and they don't really need to be in any facility. But the failure is actually where there is a disconnect between the person who is at home, falls sick, but there's no proper direct link to how quickly they can actually be evacuated to a facility that they require. So that is an issue that needs to be worked on from county to county to ensure that the linkage in terms of those who are home, who are isolating at home, and should there be a change of condition that they need to be evacuated, then that one is done very, very quickly. But still, Trevor, to revisit the issue you talked about, infection, severe infection, mortality, issues of the elderly, issues of the young people. We were not wrong at all. We still know that the elderly, those who are 65 years and above, and those individuals who have comorbidities are at a higher risk of developing severe disease and dying from COVID. Nonetheless, there is also a growing phenomena of host individuality, where two individuals, no comorbidities, young, they get infected. One develops very severe disease and almost dies from it. The other one just walks away scotch-free. So there is, again, at the host level, there is individual variability in the immune system, the way it responds. There's also genetically individual variability, whereby the interaction between the host and the individual brings that severe disease. Yeah. And that's coming out because as we move on, as more people infected, the natural history is now getting known. So we were never wrong. It's only that certain things are now becoming clear.
Okay.
What actually the host, these individuals with no comorbidities who develop severe disease, what actually mediates that are now some of the things that are under scrutiny.
Okay. So based on your trajectories, the previous ones, even currently, at what point will we then peak and then flatten the curve?
I think if all measures can be revisited, where all the sectors relook at their guidelines and go back and reinforce these issues to deal with what I've talked about, fatigue, laxity, issues to do with denial and utter refusal, we will flatten the curve. But flattening the curve just means we are reducing the number of infections and spreading it over a prolonged period of time. And that flattening will not be holistic. That flattening will be county by county. Because once we lifted the restrictions, it was very clear that the infection will leave Nairobi and leave Mombasa and begin to get into the counties. And you can appreciate, if you look at the daily tallies that are coming from the EOC, that is indeed what is happening. So what we just need is to put the measures in place to ensure that these measures are adhered to. Each sector revisits and looks at them critically to ensure that we reduce the number of infections. Because if we don't, then what is going to happen is that we are not going to be able to shield the elderly and those with comorbidities, and we are going to end up with a lot of mortality.
So, Professor, based on the projections that you guys have been working on and the models that you have, we are currently at about 45,000 infections out of 47 or 54 million Kenyans. How many infections do you foresee in the near future that will then show that we've peaked? And I know you've said we are peaking county by county, not necessarily the whole country. But how many infections do you foresee before we can comfortably say that the curve has now been flattened in the country?
You see, from it's hard to put exact numbers because models are projections. But from what we know is that we shall have to have a substantial number of infections across the board to be able now to reduce the number of people who are susceptible, and that way be able to say you have actually been able to flatten the curve, and you have actually been able to manage and spread these infections over a period of time. Because what we are saying is that the infection is not going to go away. Majority of us who are susceptible will at one time get infected. So the whole issue is to ensure that we don't overwhelm the healthcare system, as we have always tried to do, but at the same time, we avoid mortality as much as possible.
Okay.
Yeah.
Dr. Mwachonda, let me bring you back in on this. As a frontline healthcare worker, should the government consider rolling back on the relaxation protocols?
Focus right now, Trevor, should be on the basic preventive measures. And I'd say this, that the spikes that we are seeing, as Prof has alluded to, let us also agree that the political class has really led on this front of defying these same measures put forth by the Ministry of Health. I mean, the holding of political rallies, large gatherings, and where people are not putting on their masks, areas of very high transmission, and risk for transmission, and these are what is causing what we are seeing in my very good opinion, because right now restricting movement, restricting and going back to those initial measures might not achieve much, because the question is, what is it that we want to achieve with these measures? And the reality is that initially it was to make sure that our healthcare system is very well prepared. So even if you contain people in certain areas, and these same people are not adhering to the prevention measures, we are still seeing very big gatherings, and we're still seeing people not wearing their masks and even sanitizing their hands. We will still have a rise in infection. So what is more important, as Prof even said earlier also, is the communication, the targeted communication to everyone. And we have to accept one thing, that at this stage we are in of the pandemic, is that people are out of panic. Initially, there was a lot of panic about the disease. Now people have stopped. We're out of that phase where people had panicked initially. So it's more of trying to reduce the risks that will lead to further infections and transmission of the disease.
Okay. I have to take a quick break here on the Monday Report. When we come back, we have a lot of your questions. We'll pose all of them to our medical experts who are here. Dr. Mwachonda Chibanzi, Secretary General, KMPDU, and Professor Anzala, Professor in the Department of Medical Microbiology at the University of Nairobi. They're staying with us. Keep tweeting at Trevor Mbija at Citizen TV Kenya. #Monday Report. We're back in just a bit.